Hi, welcome back. Today we are going to see an important topic of discussion. That is, it is a very important topic in the maternity aspect. Whenever we see a fetal heart rate strip, one fastest interpretation tools is very much essential. So this particular tool I am going to give with the help of a mnemonic, and it is VEAL chop rule. This mnemonic helps to match the type of deceleration pattern and its cause and what exact nursing response can be carried out to the patient. So let's go into the topic. The VEAL chop is the exact mnemonic which we require to master. It is VEAL is the deceleration pattern and chop is the cause, where V stands for variable decelerations, E stands for early deceleration, A stands for accelerations, L stands for late decelerations, and CHOP is the cause, where C stands for cord compression, H stands for head compression, and O stands for OK, which is normal, and P stands for placental insufficiency. So we have to associate with each alphabet with the corresponding which is next to it, like V to C and E to H and A to O and L to P. So we can master these things very easily. Now we can see in detail what is exactly about. A is acceleration. A acceleration means it is okay in the cause, which is the normal and the reassuring sign. Means the temporary increase in the fetal heart rate above from the basal heart rate, and it sustains for 10 seconds to 20 seconds. This shows the fetus is well oxygenated and indicates the good fetal health. Here the Nclex strip is, this is always a good sign and there is no interventions needed. You can see in the picture where the acceleration is the reassuring sign. It goes down with the contraction, and once the contraction settles, the heart rate returns to normal. So this is the normal range. Next one is the early deceleration, means which is associated with head compression. The main cause is baby's head is getting compressed during the contractions. What are the features is the heart rate drops and it mirrors the contraction. And you can see in the picture, every time the contraction of the uterus, the heart rate, there is a dip. So there is a gradual decrease and return to the baseline again to normal. So the nursing action usually, it is normal, but we have to just continue the monitoring. So it is not much emergency, but one thing we can do is we can change the position of the mother. Next thing is the variable deceleration, which indicate there is a cord compression. So here the cause is the umbilical cord is getting compressed and there is a sudden drop in the fetal heart rate. Yes, this is indicated by a V-shaped or the irregular pattern from the fetal heart rate strip. So the exact nursing intervention what we can do is change the mother's position and give the oxygen supplement to the mother. Stop oxytocin if the mother is being started on it, and increase IV fluid supplementation to the mother. So these are the things we need to remember in variable deceleration. And the last thing is the late deceleration, where this indicates the placental insufficiency. The main cause of this is the placenta is not delivering enough oxygen to the fetus. How it is being featured is the heart rate drops after the contraction and starts slow return to the baseline. So we can see a U-shaped pattern in the fetal heart rate strip. So the main nursing intervention during this thing is, and which is of high Nclex priority, we have to turn the mother to the left side, to administer oxygen, increase the IV fluids, stop oxytocin, and we have to notify the healthcare provider. So the easy memory trick what we can remember is VEAL is the problem and CHOP is the cause. So V for variable deceleration, that is, it is indicating the cord compression, and E is for early deceleration, which is indicating the head compression, and A is for acceleration, which is an okay sign, there is no problem with the fetus, and L is the late deceleration, means there is placental insufficiency. We can remember in this way. So this is all about this particular topic, a small mnemonic which can help you to break down the fetal heart rate strip and go about the question and crack down the answer and choose the correct option and help you in mastering this particular topic. So thank you and happy learning.